This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. Delighted you're with us today. And today we're going to talk about a topic related to women really taking the lead and looking at the healthcare journey that they're on and some of the things that can help them along that journey. We're delighted we've got Laura Swaney, who's the Division Vice President of Women's and Children's Services at Medical City Healthcare with us today. Laura, welcome to the show.
Steve, thank you so much for inviting me. I'm honored to be able to participate this morning.
Well, we're delighted to have you. And as we look at women and look at their health care and we look at the journey that they're on, what services do you think by age are very important for women?
Well, Steve, that's a great question. You know, I guess I would like to kick off by simply saying there's no time like the present for a woman to be a active participant in her healthcare. The reality is so many women nowadays are CEOs of companies, they're CEOs of their homes, and so they play such strong leadership roles in our community, in their personal families, and they need to also be CEO when it comes to their body and their health care. And so in saying that, when you really consider sort of that more global lens, that more global approach, when considering a woman at all ages and stages of her own life and her own physical development, there would be very specific services for each age and her lifestyle and her choices. So those services may vary, but if I, again, take that more global lens, you'd start off with consideration around GYN and gynecology, and looking to see if, specific health systems have that ability to do the more advanced robotic surgery now, which then, of course, leads to minimal downtime, which is so important for women to be able to kind of get back into the game and back to leading their families and companies, et cetera. But looking for imaging, diagnostics, so lab, testing, those are paramount for women of all ages, regardless of where she is. Then you'd have to also consider, is she looking more towards her fertility and wanting to start a family or extend her family? And then you'd consider services like the age of the mother, so advanced maternal age. That could become incredibly important in looking at reproductive medicine or maternal fetal medicine. Many women themselves now are finding themselves with hypertension or high blood pressure. In a case like that, or maybe even they were a previous cardiac patient, we are seeing, post-COVID, and I say post-COVID meaning post-COVID diagnosis. So a woman that may have had COVID and now she's got some residual things going on, and she may have visited a cardiologist to make sure that heart is strong. In that case, you'd lean towards obstetrical cardiac as a specialty, and wanting to make sure that a woman would have access to a cardiologist that specializes in a pregnant woman with cardiac disease. So these become all the sort of services that bolt on, if we think about it like a car, just sort of bolts onto the chassis of that vehicle to really care for a woman regardless of her age or stage of life. Maybe fetal surgery program. Maybe she would need to consider fetal surgery options. I mean, some of these things are they're fascinating, and I don't know that women necessarily know that there are all these services, even for her unborn child, prior to the baby, again, being born, that there's intervention that can happen to give both mother and baby the best possible shot at success at the end of the delivery. Last thing that I think a woman would always need to consider is that at some point, again, if going into the hospital is going to be necessary, if she's going to deliver her baby, wanting to consider then the level of care that the hospital can provide. So the complexity of the maternal care that can happen at that facility, or the potential of neonatal care for her baby, and looking to keep that under one roof so that her and her baby don't necessarily need to be separated if really high level of care becomes needed.
Thank you for that answer. And, if we drill down a little bit, What would you suggest to women when they are deciding where they want to deliver their baby? And let's assume they're deciding a hospital, not some other form of birthing. But if they're going to choose a hospital, what are some of the key things they should consider?
Again, Steve, I would fall back on this idea of preparation. It's always preparation, right? Prior planning prevents poor performance, the 5 Ps, things I teach my sons. The idea of creating a plan. And so, again, it's the importance of working with the physician, working with the hospital, creating a birth plan, really that's customizable, because every birth is not going to be the same, because quite frankly, every woman is not the same. And so having that opportunity, working with their doctor, working with the hospital to really design what it is that they are hoping for. And then the reality is life happens. And so again, it's that preparation and knowing, okay, outcomes, the experience, the level of care that the hospital can provide within this hospital, so that they can handle the highest levels of complexity. Looking at those experience scores. I mean, nowadays we just live in a Yelp review society. So having the ability to really do our homework and create that plan, read up on the hospital, look at the reviews, see what other women are saying about their birth experience. Ultimately, women should feel empowered. They should feel empowered to not only have a voice, but use that voice, in ensuring that the hospital and their physician value that voice, value their opinion, that it's prioritized. I call it Dr. Google. We may Google and Google and Google, and then we go into our physician's office, and then we ask the question, and the answer might make us uncomfortable. And that's okay. We are not the clinician. What really is important is being able to feel safe to say, I'm uncomfortable with that. Can you talk me through it again? Can you really explain to me why you recommend this? Is that my only option? Are there other things to consider? Never be ashamed or feel as if your voice cannot be heard. And I think we have so many in this area. We are just so blessed and fortunate. I've worked in healthcare in a couple of different states, and we are so blessed within DFW to have clinicians and hospitals that really do support exactly what I'm describing. And so women shouldn't feel as if they can't ask those questions. So when women are looking for a delivery hospital, create the birth plan, really do your homework. Talk to your physician about what it is that you're hoping for. Ensure that you feel safe and heard and validated. Even if the answer is something you don't want to hear, you want to make sure you have the opportunity to say what it is that's bothering you or your concerns. And then again, looking at the hospitals, looking at their outcomes and their patient experience and the level of care that they can provide both for the woman herself and also for her baby.
And obviously, we're talking about empowering women in healthcare. What an appropriate topic to be talking about this Labor Day weekend. Hope yours is going well. We're listening to Laura Swaney with Medical City Healthcare, and we'll be back with more of her conversation about how women can take control of their health next on the human side of healthcare.
This is the human side of healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're continuing our conversation with Laura Swaney. She's the Division Vice President of Women's and Children's Services at Medical City Healthcare. We all know that one of the things that has been challenged this past year is the doctor-patient relationship, because we've had to do all these virtual visits and the relationship with our doctors has changed. And for women juggling so many balls now, one of the ones that could get dropped is the importance of taking care of our health. Here is Steve and Laura continuing this conversation of empowerment.
As you mentioned, the woman needs to be empowered, make decisions, talk to the physician, be totally involved. What do you think patients should do as far as their overall expectations to ensure that they are included and they're being accepted and their thoughts and ideas are being shared? Any helpful hints to ensure the women are definitely empowered and included?
So I think my biggest recommendation on this would be, there's a great book, talks about the importance of leaning in as a woman. And again, I think we have become such drivers sort of at the helm in so many different facets of our life, again, professionally, personally. Yet I don't know how often women feel that they should lean in when it comes to their health care, which really ultimately should be the most important thing, right? If you're healthy and strong, then you're in a position to continue to care and love and serve everyone else that you are doing that for, that you're sort of opening your arms for. But your health and well-being really is important, and it really does come first, because that is the only way we can support others. So my biggest piece of advice really would be lean in. Don't shy away. Don't shy away from the difficult conversations. Don't shy away when you hear something and you don't understand it. Don't be afraid to say to your physician or at your hospital, I don't understand what you're explaining. Can you explain it to me another way? Don't be ashamed to say what you don't know. I'm not a doctor, right? We actually are not all clinical providers. So we don't know all of these things. And you can Google, the world away. But ultimately, that face-to-face conversation you're having with your healthcare provider is so paramount. And so your ability to ask the questions, and again, exceptional healthcare is truly built on a foundation of inclusion, compassion, and respect. So if you're working with a provider or a health system where you don't feel like that's the case, then it really is time to look for the next one that's going to ensure that those 3 foundational things are present. So lean in, ensure your voice is heard. Don't be afraid to ask such important questions that you might have so that you have a better understanding of your health. That would be my biggest recommendation.
Thanks, Laura. And, I'd be remiss if I didn't ask you this. As women on their healthcare journey, unfortunately, in the last 18 months, there has been this thing called COVID-19. Do you have any thoughts you can share related to maybe women that are pregnant, they're thinking about becoming pregnant, and whether they should get vaccines related to COVID-19?
Yeah, this is an interesting time that we live in. I mean, who would have predicted this? 24 months ago, it seems like our entire world has truly gone sideways. We talk about my sons, they're 18 and 16. They talk oftentimes about how eventually in the future you will read, their children will read about this pandemic, quite frankly, in their history books. So it's definitely thrown our entire world for a loop. And being incredibly unsure of what is this vaccine? How quickly was it rushed through? I've heard so many of my friends not in healthcare talk a lot about that. It didn't go through the same amount of rigorous clinical trial, or, we really don't know of its safety. And the first thing I would always ask friends of mine, just sort of as a pause and a reset button, I would simply say, well, how long does a drug typically go through clinical trials? How long does it normally take a company to get a drug approved or a vaccine approved? Nobody really could ever answer that question. And so we have to make sure that we separate ourselves from what we maybe hear potentially, through the media that we read online, or, just because something's written online doesn't necessarily make it accurate. And so this is where we need to lean on our healthcare professionals and some of the great organizations that we have in healthcare that are guiding us around the recommendations. The CDC, ACOG, which is American College of Obstetrics and Gynecology. These are some of the great organizations. American Academy, AAP, American Academy of Pediatrics. These are our founders, right? They give us the guidance around what is safe for your child, what is safe for you. And there is no shadow of a doubt, all of these organizations have gone on to say, get the COVID vaccine. If your child is of age to also be able to receive the vaccine, you get the vaccine. Now, of course, the caveat is you always talk to your healthcare provider. Your healthcare provider will guide you specifically on your case and what the recommendation would be for you. But we seem to have stalled out on the vaccine front. Here we are. We've got these vaccines available. There's no shortage. They're not being held back from anyone. So everybody at this point can really roll up their sleeve, get the shot in the arm, and get back to life. And the interesting thing is what we're seeing now, obviously, with the newest strain, the Delta variant. People that are vaccinated are just sort of breezing through this Delta variant. Those that are not, this is where the disease is spreading. So again, we lean on the highest voices when it comes to healthcare. ACOG, American Academy of Pediatrics, the CDC. The recommendations are very clear. Get that COVID vaccine and let's get back to life. So talk to the healthcare professionals and roll up the sleeve and let's get moving. That would be my recommendation, Steve.
Great recommendation. I've asked a few questions. What question should I have asked you that I didn't, that comes to mind? Or is there a message to our listeners related to women and their healthcare journey?
I think I would just wrap up by reiterating sort of how we began, Steve. Women are the CEOs of every aspect, seemingly anymore, of their life. Be the leader of your body. Be the leader of your health. The importance, again, of leaning in and be an advocate for your health care. Have that great, trusted, open communication with your physician. Again, in my space, which is women and children's services for my company, for Medical City Healthcare, it's interesting to me when I talk to, OB-GYN, obstetric gynecology physicians, how they'll say it always pains them. They can see that there's the patient, the woman may have one last question and she's afraid that whatever it is, she's almost nervous to talk about it. And then what I always hear from them is this sort of resounding, there is no question you can ask that is going to throw your physician for a loop. A great physician, quite frankly, they've already heard it all. They know it. They've studied it. So there's no question you can ever ask that you should be ashamed of. This is your body and that's your physician. So whatever it is, you talk to your physician about it. You get the proper guidance so that you can lead your healthcare, ensure you have good health, you're strong and healthy, so you can go on and lead your families and lead in your professional world exactly like you have been doing.
Thank you, Laura. Laura Sweeney, Division Vice President of Women's and Children's Services at Medical City Healthcare. Great tips. And a quick little segue over to another issue that women are basically managing today in most cases. That is the kids at school. Fortunately, so far this year, COVID has not erupted in most of our school districts around North Texas. And one of the reasons is that many wise parents, kids, teachers, and administrators have chosen to set politics aside and do the right thing for their health, which is wear a mask. Why? Very simply, because it works. And we wanted to just revisit a quick comment from Dr. Jeffrey Kahn, who is Chief of Pediatric Infectious Diseases at Children's Health and a professor at UT Southwestern Medical Center.
We know how to stop this virus, and that is wearing a mask. It's a low-tech solution that really works quite well. We've proven it for other viruses. We've proven it with COVID. There's a lot of talk out there about masks not working. Well, I have a lot of colleagues who've been taking care of kids with COVID for the last 15, 16 months, and none of my colleagues in my division have gotten COVID. Why? Because they're wearing a mask and they're taking precautions. So this really, really works. And of course, it's not just my division. It's any healthcare system that you look at. You look at people working in ICUs where there's a lot of COVID, a lot of sick patients, a lot of aerosols. And the infection rate in hospital settings is remarkably low, which shows that these types of measures, these types of behaviors work really, really well.
And when we come back, we're going to bring in Dr. John Carlo again, Prism Health North Texas, FDA approval, booster shots, and more, keeping you safe during COVID. Next on the human side of healthcare.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome to the human side of healthcare. We're delighted you're with us today, and we want to just talk a little bit about vaccines, COVID-19, a little bit of everything, and that's why we brought in an expert. Once again, we're delighted we've got Dr. John Carlo with us. He's president and CEO of Prism Health, North Texas. He also is very active in the Texas Medical Association, and he's on so many committees there, it's just too numerous to mention. But John, welcome to the show.
Thanks for having me again.
You know, I almost jump right in. We're so excited that now Pfizer is no longer emergency use. But the question, this new medication they're coming out with, or at least the new named medication, is it the same formula?
No, that's actually a good question, and important to remind everybody that it is the same vaccine. There's no reason to wait for a new shipment. And I think that it is an important distinction, and one we should continue to remind everybody that this now is no longer emergency use. It's fully approved by the FDA, and that's because it's got really, really good safety data now that has shown experience over a significant amount of time, which is above what we were looking at with just the EUA. And so now we have a fully approved vaccine, which really tells us that it's exquisitely safe. And, you know, we already knew that because of our experience in the real world. We've already given out over 350 million vaccines in the United States. And the watchdogs that are looking for all of the potential safety risks, this is an unprecedented observation and investigation period where we're looking for any and all potential safety issues. And I will tell you, looking at those very carefully from all the 6 data reporting centers, we are dealing with a very, very safe vaccine here. And that's just a really, really good thing. So I think we should celebrate that we have moved from the EUA to full approval, noting that it's because of that really, really good safety profile.
You know, I read where, the messenger RNA, which was used obviously with Pfizer and Moderna, actually was developed back in 2008. Am I right in that assumption?
No, that is right. You know, there has been a misperception, I think, out there that this is a new and untested technology and would cause us to pause and be cautious. The mRNA technology has been around for a long time. It's being used in other medical applications very successfully. It is true, this is the first vaccine that is using this technology, but we've been familiar with the technology through other applications, other medications. So yes, absolutely right. This is something that's been with us for some time. But again, the good news is we've been able to really utilize that technology successfully in order to really get this vaccine out so quickly and so effectively.
You know, John, the emergency use authorization really has been removed for 16 and older. What about parents that have kids 12 to 15? It's still under emergency use. That's somewhat problematic if they wanted it completely removed.
Right, and that is a distinction to look at in terms of how the FDA goes through the approval process. And as you remember, the Pfizer vaccine was originally approved from ages 16 and up under the emergency use authorization, and then later they extended that down to the age of 12. And so what we're working with here is a timeline, and it really has to do with the approval process and looking through the approval windows. So, the FDA had experience enough to say this is full approval in the age group of 16 and up. And they left, with the ages 12 to 15 under the EUA. But I think very, very quickly we should expect the approval to go into that different age group, the younger age group. It's just simply a process of time to make sure that we have enough time experience to make that full approval process. But I fully expect that to happen. So at this point, there's really nothing parents need to do any differently. We're still dealing with the same vaccine. It's just a matter of getting the approval process done based on the amount of time that they've had to look at the vaccine.
Good point, John. And, as we look at potentially down the road where the age drops to, say, age 5 or maybe age 6, would you assume when that happens, it'll be emergency use authorization?
That's a really good question, and something that we've been watching for very carefully. So what we are hearing right now is that the FDA is looking at the ages of 5 to 11 and attempting to get an approved vaccine as soon as possible, because this is a real critical age group, I think, especially looking at our schools and our school safety. And so right now we're hearing that is something that is on the priority list by the FDA. They are signaling that we could see something as early as the end of this year, but probably closer to 2022. And there has been some discussion about the amount of observation period that the FDA wants to see in looking at this age group in particular before they make a decision on either emergency use or full approval. So that decision is still, I think, well underway and not have been made yet. But I will say that a number of advocacy groups across the country have really been urging the FDA to look at the consequences of the Delta variant that we're seeing right now, as well as the desire for school safety and keeping our kids in school. So I think that we'll be hearing more about this over the next few weeks. And keep in mind, this is the first step. And the second step, I believe, will be then to go down to ages 6 months through age 4. And so each of these groups and segments will be looked at very, very carefully.
John, as we lower the age for the vaccine, when you get into 6, 8, and 12 months, the concentration that's in that vaccine is going to be much different than an adult, and that's what clinical trials are all about. Is that a good assumption?
I think overall it's probably a reasonable assumption. There are caveats to that, and it is a complex question that is answered, thankfully, through rigorous study and investigation. And so, by the time we have that answer, we have looked at it very, very carefully and have really developed that. The goals, of course, is that we want an effective vaccine that works very, very well for a wide population, even in that age group. And then we have to look, of course, at the safety profile. And absolutely, there are many examples with other vaccines where perhaps the concentration or the volumes change or things like that. But that's one of the things that's important to allow for in this process of getting the research underway and the studies done so that we know the answers to those questions.
John, I'm going to pivot just a little bit and let's talk booster. First, what vaccines are eligible currently for a third booster?
Yeah, and I think it's important to start with an important distinction that is out there, and I think that it is confusing, so let's sort of break this down together a little bit. There currently is a third dose recommendation, which is a little different than how I would look at it as a booster dose. So when you talk about a third dose, what we are working with is in some individuals, and particularly those that have medical conditions that we call being immunocompromised. So this is like organ transplants or being on medications that affects our immune systems or having an immunologic condition. What we're finding is in these individuals, the 2 doses of the mRNA vaccines just aren't enough to get a good, robust immune response. And so the recommendation now is for those individuals with those medical conditions to go ahead and receive a third dose of either the Pfizer or Moderna vaccine, and they're recommending it almost at the same time period as if the distance between the first and second dose. In other words, about 28 days. This is a very different distinction from what we're dealing with, I think, next is the booster dose. And what the booster dose is, it's a different idea. It's saying that the initial 2-dose vaccine worked, but over time, the antibodies and the immune system that has really been successful is waning over time. In other words, over a certain period of time, that effectiveness of the vaccine is showing to benefit by having an additional challenge, which we call the booster dose. Now, as of right now, and I think this is an important timing distinction, we do not have in the United States a recommendation for a booster dose. That could change almost tomorrow, because that is really something that the CDC and FDA are looking at very, very carefully. And so what we don't know right now, under that idea of a booster dose, what that time frame would be like, and then who would really benefit the most by going ahead and getting the booster dose. I think that those that will be recommended will be different, probably a larger group than the third dose individuals. And the time frame we think it'll be about 8 months, but it could be earlier than that. But again, right now, as of today, we do not have a recommendation for a booster dose, but we have heard from the CDC that is coming, and that recommendation should be pretty soon in front of us. And, the other point to make on that is other countries such as Israel and some European countries have already taken this on and are doing booster doses. And we're going to look at that data very, very carefully to really help guide some of that decision making. So I think that's where we're headed, but it's an important distinction to make between that third dose and that booster dose.
We're listening to Dr. John Carlo, CEO of Prism Health North Texas, also just recently appointed the chair of the Texas Medical Association's Council on Legislation. More on these latest updates from the FDA and the vaccination next on the human side of healthcare.
Covering the healthcare topics that matter most to North Texas. This is the human side of healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
And we're glad you're back. We're continuing our conversation with Dr. John Carlo, who is president and CEO of Prism Health North Texas. In our last segment, we talked about the distinction between booster doses and a third dose for immunocompromised individuals. And that third dose is where we now pick back up. Steve?
I'm going to talk a little bit about third dose, not booster, but third dose. I've got friends that I know that have underlying medical conditions that have already gotten their third dose. To our listeners out there, if they are over 65, are they eligible currently for a third dose?
So that is a really hard question, and I think I've been asked that a lot. And what I recommend for those that are thinking about whether they are a candidate for a third dose, not the booster dose, is to talk to your physician, your health provider, and really go through that conversation very carefully. At this point, the sort of the ways you want to look at it, I guess, is it does not look to be harmful to have a third dose. The real question is whether there's a benefit, whether your body has developed its immune response adequately so that third dose is perhaps not necessary. And that's a judgment call right now. And I think that we're being very cautious. So I'm hearing that those that are perhaps not in that defined group of being immunocompromised, but having medical conditions that might put you at higher risk are being considered. And I think, again, that's an individual decision, weighing out the risks and benefits. But overall, I would say that there's no harm, at least at this point, that we can find in getting that third dose. But it's something we'd want to do very carefully and under advice of a clinician.
John, along those same lines, I'm just going to ask you some real quick questions here. Let's assume someone has had both doses of Pfizer, and when they get a third dose, Pfizer, for whatever the reason, wasn't available. Could they take Moderna?
Yeah, so this has been brought up. A couple things that the recommendation is to try to stay with the same vaccine. So, in other words, if you did get the first 2 doses with Pfizer, it's best to stay with Pfizer. The options are, if you are not able to get that same vaccine, one is it is okay to wait. They did point out that it's not urgent to on a day-to-day basis get that third dose, but they also saying in recommendations by the CDC is that it's permissible to go ahead and perhaps use the Moderna if you started with Pfizer. We think that is okay. But there's a couple caveats to that. Number one is there's no recommendations to mix the non-mRNA vaccines. In other words, there's no recommendation to mix the Johnson & Johnson or Janssen vaccine with either the Pfizer or Moderna. And overall, there really isn't any indication that there would be a benefit to switching. So really the data that we have looking at the third dose in particular is really staying with the same vaccine. So following the science would be to, stay with the same one. So we don't think that there's a benefit for crossing, but we also think that there's not any harm, and it does appear that there would be, equivalent responses if you had to switch. So it's sort of a mixed message a little bit, but I think there is an important distinction about, trying to do the best to keep with the same one you started with.
John, we recommend that people get vaccines. A friend of mine who is somewhat reluctant to get the vaccine said, if I get COVID, I'm going to go to the infusion center. But when I talked to a physician at the infusion center, he said the messenger RNA process in the vaccine is much more time tested than, say, the Regeneron that's used in infusion. Your thoughts on that?
In the particulars of the monoclonal antibody, I'm not as familiar with it's very, very early and I'm certainly not the expert in that. But what I think is interesting is how we as individuals make those risk benefits calculations. And I do find that interesting that we're perhaps more receptive to taking something that's even more experimental at the expense of not vaccinating, which we have a lot more safety information and a lot more confidence that it's going to do what it's supposed to do. And so, I don't have an answer to that other than just realizing how significant that is. And I don't know how we fix that, but it's definitely a situation where almost the more we talk about it from a risk benefit and sort of looking at it from a calculation standpoint, it almost is turning more individuals to the exact opposite of that calculation. And I don't know the answer to how we fix that, but it's certainly something that we're seeing, and I wish we did have an answer because I would love to be able to change some of those perceptions.
John, I saw a story yesterday here in North Texas, and it truly broke my heart. You may have seen it. There was a family, and they made a decision, and again, I'm not being judgmental, but they decided they weren't going to get vaccinated. Their 19-year-old daughter's preparing to go to college, unfortunately got infected with the Delta variant, and she passed away, 19 years old. With that said, we're in the midst of Labor Day. What are your thoughts on Labor Day, crowds, wearing masks? What should we do to prevent this Delta variant spread?
Well, there's a couple of things that you point out, and I do want to make one point about the vaccine that is an important thing, I think, for all of us to be aware of. If you look at our history, and not the coronavirus vaccine history, which is, of course, very new to us, but look at the past and our experiences with vaccinations in the past, our successes for vaccines have really relied on population percentages to be very, very high in terms of the number of people that would have to get the vaccine in order for the vaccines to work. So this distinction is not unique to the coronavirus vaccine. And I think overall you were talking about numbers around the 90% or even higher to really get where we need to be in terms of generating a population-wide protection, which is, I think, our goal. We need to sort of frame this goal as we don't want to have coronavirus in our communities anymore. How do we do that? And I think the answer would be we'd have to reach that level of vaccination. Right now in Texas, we're, of course, well below that. So I will leave sort of the open question, which I don't know the answer to, is how do we get from point A to point B? Or is it even feasible at this point, which is, I think, an unfortunate reality. But it does bring us to your question then. If we don't get to that point, what does this look like for us going forward? What does it look like for Labor Day weekend? What does it look like going into the holiday season at the end of this year? And I think that we have to really realize that there is just a tremendous amount of complacency that's been created through this process, and it's rather unfortunate. And I'm surprised that the mask wearing is not being taken as seriously as I think it should. I think we all want to go back to socializing and doing what we do in our leisure time, but I think we're neglecting the fact of how busy our hospitals are right now, how much our healthcare system and our healthcare workers are under stress, managing very, very busy hospitals and nearly full ICUs. And so it is remarkable to me to know that many are thinking about Labor Day holiday activities that will involve a lot of gathering and perhaps risky activities in the face of a pandemic that's really unabated. Unfortunately, we don't have a way to get to that vaccine level immediately, and our healthcare system is really under stress. And so, whatever we do, I hope that the message is we've got to support our healthcare team and our healthcare system, and if that means perhaps wearing a mask or avoiding crowds, I would say that's a reasonable sacrifice. And I hope more people take that information and use that to make that decision.
Dr. John Carlo from Prism Health North Texas, thank you as always for your thoughts on the latest on COVID. Steve?
Thanks for joining us today. Please enjoy your Labor Day weekend. Be safe, wear a mask, and we'll see you next week on the human side of healthcare.